Perfect. Great. Well, welcome everybody to the ARPA Homelessness Advisory Committee meeting. Hi, Commissioner Hool, come on in. We have online with us right now, we have Scott Pruitt, Stephanie Jennings, Heather Dorsher from Cloudburst Group. They're going to be presenting to us on the current updates, the findings to date on the homelessness strategic plan. They also have some starter ideas as to some of the strategies and tools that we can use as a community to help prevent and reduce homelessness in our community. So I'll turn it over to them in a few minutes. But before we have a couple of housekeeping items, there's a sign-in sheet going around. If we could get your signature, please. You'll see on the agenda, we were going to introduce you to Roderick Wallace, our new ACD director, but he had to leave town for a family issue, and so he's not here with us today, but he sends his regards. Hopefully in the next one, you'll get to meet him in person. But here from staff, we have, again, Alejandra Calva, we got Coral Rogers, ACD, we've got a couple other people. Do you want to introduce yourselves?
Sure, I'm Lillian Trankoski, and the homeless specialist. And I'm Katie, I'm the intern.
I'm Cameron, Equity Engagement Coordinator.
I'm Paige, Data and Outcomes Coordinator for ARPA.
And so a little bit of everyone, and then of course, Commissioner Cool in the back. All right, so let's get started. Let's get the minutes out of the way from our last meeting, which was in November. It feels like forever ago, but I feel like we've also had a lot of conversations in between. So if I could just get a motion and a second to approve the minutes from the November meeting. There's a couple copies floating around. Anyone else need a copy from November?
I'll motion to approve the minutes.
I have a question about them. Are these links? And so they're linked to explanations of the?
No, I'm not sure why they're underlined. They should not be underlined. They're not.
Okay.
But good catch on that formatting.
Well, I see that these things were discussed, but I don't see really anything about where the discussion went. I was hoping they were linked.
Okay. Well, we can make sure that the next ones definitely have those details.
At least something about what the outcome of the discussion was. Thank you.
Would you like us to go back and add more detail in and bring it up again for?
Well, I don't want to be the lone voice saying that, no, but like, I don't feel like I'm informed about what these items are.
That's fair.
I support that idea.
Okay.
Thank you.
All right. So we'll go back through these and edit them and send them over to you all.
Sorry.
No, you're
Thank
fine.
you.
I appreciate.
Recorded,
This was recorded as well.
so maybe we could have that link added too.
Mhm. Yes. Okay. Noted. Okay. Then just a quick update about the home allocation plan. We submitted it to HUD, yay. No instant rejection, yay. So right now what's happening is that HUD is reviewing it. They're gonna circle back with us in case they do have any feedback or any changes that they do want us to make. We don't expect to hear back from them for a couple of months, just given the vast number of plans they got by March 31st. But we'll keep you all posted. Hopefully that timing will align really well with what we have coming up with the strategic plan. And again, we have that chance to align the funding streams to make sure we're addressing everything we want to. So that's the sweet update on that, on the home allocation plan. So now, again, we're still working on that, on the larger strategic plan. So I'm going to turn it over to Cloudburst unless there's any questions or any other items you want to add to the agenda. Okay. Right, so Cloudburst, if you want to take over.
Yeah, thanks, Alejandra.
Can you have the volume on our side? Hang on 1 second, Scott. The volume's.
Yeah.
Okay. That should work better now.
Can everyone hear me better now?
Yeah.
Okay, great. So my name is Scott Pruitt, and I'm the project manager for Cloudburst engagement with ACC Gov. I'm a data and evaluation specialist here, and you all have not had the opportunity to meet my two colleagues, so I will let them introduce themselves. But I am joined by Stephanie Jennings and Heather Dukeshire.
There, my name is Stephanie Jennings. I'm a senior technical assistance advisor for the Cloudburst group and work a great deal on home, CDBG programs, affordable housing, and community development. Heather?
Yeah, I'm Heather Dukeshire. My pronouns are they, them, and she, her. I've been working with Cloudburst for about 6 months. I do work both in the realm of products like Home ARP, but also around homelessness response systems. So I've been working with Scott on this, and Stephanie, of course, on this project for just a little bit now.
Thank you. So for our agenda today, we will go over the goals of the strategic plan. We have been able to have ideas take shape in a bit more comprehensive way. Talk about the work that we have completed to date. And then we have 3 buckets of key findings to discuss. So moving through unsheltered homelessness, emergency and transitional housing, and permanent housing. So within each of those, there's a couple key data points we're going to present, but then also talk about some ways other communities have approached these problems in a general sense, and really wanting to hear from you all, your reactions, thoughts, feedback about what strategies might be appropriate or feasible in Athens. And then we'll wrap up with some next steps. So the strategic plan, the organization will, be about needs. So what are the current needs and gaps in the service system? And a lot of the discussion to date has focused around that with, especially the needs and gaps portion of the Home ARP plan being such, as a significantly important part of that work. We're also looking at what resources are available right now in the community and how they're currently flowing out. So how your CDBG dollars are currently going out, and other programs as well, like COC, really all of the major federal and local funding streams. We are also working to identify strategies, as we just talked about in the agenda, and then work with ACC Gov and other stakeholders to really float some things through the top. And what are the top recommendations that Athens has for how to improve homeless services? And with that, develop some best practice models of how that strategy might be implemented, how much might it cost, and what funding sources are available to be able to pay for that. We are also going to work with ACC Gov with the strategic plan to present an allocation of the ARPA funds, much like what you saw for the Home ARP allocation.
What do you mean you're going to work with ACC on the distribution? What was that? The allocations? You guys will be part of the grant making process?
No, so the allocation will really be like what you saw in Home ARP, where it's thinking about what buckets of money ARPA can go to. And it's just, when we say we're going to work with ACC Gov on that, what we mean is, we are consultants, and you all know your community best. And so we will not be telling you how to spend your money, but rather working with ACC Gov and, like I said, other stakeholders, yourselves included, who know your community the best, to decide how that funding should be allocated.
They won't be part of the actual grant award process, but they'll be able to help us figure out, should we be spending, how much of the 5 million more or less should we be spending on rapid rehousing, or perhaps on supportive services, or perhaps on
So
those
buckets
big
within the bucket we were given.
basically, because there's a lot that we could do with that money, right? And so that's what they're going to be helping us do, similar to what we did with Homework, based on,
A lot with 5 million.
I know, I wish we could have had more, but not specifically like picking agencies, et cetera.
And my understanding is that the purpose of this legislative group is to approve that plan that they're creating.
You will all have an opportunity to give us feedback on the plan. Unfortunately, because you all stand to gain from this plan, right? Like if you, for example, if Shay, if this group decided to
should all go to
say
family
that it all should go to family, homelessness, et cetera, obviously you're putting yourself in a situation where it's a little bit not shady, but it doesn't look good, right? Because you're kind of directing the funding. And so you will all have a chance to review the full plan, give us your feedback, make sure we capture what you all think is needed. But ultimately, ACC Gov will determine the final plan. And ultimately, it's a commission, right? The mayor and commission who vote yes or no.
Which will be informed by this, they'll be informed by
Yes.
this overall report and plan.
Absolutely.
We get to provide feedback on.
Similar, basically the same process as Homework. I know initially this group was laid out to approve and create the plan, but there's just these, what's the word I'm thinking of?
Conflict.
Thank you, conflicts of interest.
Just to confirm though, the plan is larger than just the allocation of ARPA funds. It's an actual strategic plan, and that's just a portion.
Correct. Yeah, that's just a portion because we have to spend $5 million in the next 2 years.
Right.
Or 3 years.
The plan will.
And it'll be like a larger plan.
And part of what Cloudburst is doing is saying this funding stream can fund this bucket, this funding stream can fund that bucket.
Right. And also what other strategies can we use as a community to keep going beyond those $5 million? And unfortunately, this is a closed committee meeting, so we're not taking public comment at the time, but we can discuss any feedback from the public after the meeting. But thank you for your interest. Does that answer? Yeah? Okay, of course. Go ahead, Scott.
Thank you. Okay, so we have been working to collect feedback. Some of it went into the Homework plan, and some of it is unique to the strategic plan. So far we have facilitated 8 listening sessions to really capture pretty diverse perspectives across the community of what the needs are and what the impact of different efforts, programs, et cetera, have been. I know many people on this committee have participated in one of those, and I so appreciate that. We've also reached out and talked to neighborhood leaders, the business community, student groups, to again really get as diverse of perspectives as possible. We've also been working through pretty robust data collection. While I was there in January, we completed 20 client interviews, really wanting to hear from people who are experiencing homelessness or were recently experiencing homelessness, to hear their perspectives on what's working, what's not, and what their recommendations were. We've also reviewed a tremendous amount of data. We're still working through from HMIS, from McKinney-Vento school data, to understand current flow through the system and current system outcomes. We are currently working through provider interviews, and I know many of you, again, were invited to those. If you have not responded, please do. We would love to be able to hear from you, and those interviews are very much focused on strategy development. We have also looked and are currently wrapping up a review of the funding levels for your HUD CPD program. So again, ESG, COC, CDBG, that kind of stuff. And how those are being distributed to the community and yourselves as providers. And so what's working and not working from that process. And just provided some support to the Home ARP allocation plan and review, which I believe is, like Alejandra said, is now with HUD. Any other questions, actually, before I move into key findings? Okay. So what have we learned through this process? And probably a lot of this is not going to be a tremendous surprise to anyone here. But unsheltered homelessness in Athens has increased. This is your point in time count. There's no 2021 data because no unsheltered count was conducted in 2021 because of the HUD COVID waivers. And your statewide, the unsheltered point in time count has increased by about 1,400 people. And if you look at the national total point in time counts across all communities, again, unsheltered homelessness has increased. So this isn't a trend necessarily unique to Athens, but it's something that has definitely been commented on with programs really straining to serve the number of people who need to be served. We know, and you all know, that the point in time count is probably an undercount of homelessness. And, you know, really any data source on homelessness is flawed in some way. What the point in time count is really good at is looking at trends such as this and being able to say over time, here's how things have shifted. And so over time, we are seeing these year-over-year increases, particularly in unsheltered homelessness.
Can I make a note on that?
Oh, yeah.
I would just like to note that we got a street outreach team in Athens for the first time in 2019. So I don't know that the numbers prior to 2019 would be super reflective without an outreach engagement team that's developing and building rapport with people living unsheltered.
Mm-hmm. Thank you. That's good context.
And also in our numbers this year, we had one of our major shelters essentially shut down, which is pretty significant. When you're talking about this level of figures, that's pretty significant.
Mm-hmm. Mm-hmm.
And that's 70 beds.
Yeah.
Other comments on the pit? Oh, yeah, Michael.
I mean, this graph shows a bar graph that goes up and up each year, but then it looks like there's also a line graph superimposed that seems to peak in 2020. Can you explain that?
Yeah, so that is looking at the percentage of your total pit count. What percentage of that was people who were unsheltered? And so you see it go kind of up where people living unsheltered were a higher proportion of the total pit count. And then it did go down in 2022, not quite to where, you know, it was before the pandemic. But that is also just a reflection of not just unsheltered homelessness going up, but the total number of people that you captured who were experiencing homelessness.
And actually, Madison corrected me. That's the 22 figure, not the 23 figure. So
Yes.
Salvation Army was open.
Okay.
Both shelters, all shelters were open.
And in fact, the reason why the 2023 numbers are not up there is because we're still digging through the data and the duplication efforts, et cetera. So we're not quite ready, but Cloudburst will have that before the plan is complete.
So I'm interpreting that right there based on what Michael's question was, is that we actually in 2022 had an increase in shelter capacity, basically. Or that's how I'm interpreting that. We increased unsheltered beds, but we also had an increase in sheltered bed capacity, reflecting a higher number of sheltered individuals counted in the point in time count,
That would have,
corresponding to the higher number of unsheltered counts. Is that an accurate interpretation?
capacity did increase 2020 on, I mean, it did,
Yeah.
so. it would-
Creation of like the hotel program, for
The
example.
hotel program, the increase, I think rapid rehousing numbers.
We
were
did 3
increased
times as
too.
many shelter.
Yeah, so,
Yeah.
so I'm just, putting a positive spin. I think, the shelter providers here increased capacity. I think Bigger Vision started to be open more and increased.
What year did you guys start staying open year round?
2017.
Okay. Anyway, I was just trying to interpret that.
But the increase in shelter capacity hasn't stuck. I mean, I know you guys have continued the hotel program, but we went back to our normal numbers and a wait list. So
And to be clear, the rapid rehousing numbers are reflected in the housing inventory count for point in time,
Yes.
because those increased dramatically.
No,
Not here.
sorry. Rapid rehousing, people staying in rapid rehousing are not considered homeless. They're housed.
Good. Thank you for clarifying that.
Yes. Okay, thank you. So, moving to the next slide. So another theme that we have been examining is an equity analysis. And there's equity, through lines through all of the programs and outcomes, but in unsheltered homelessness, Black African-American individuals are overrepresented in homelessness as a whole, including unsheltered homelessness, but underrepresented in street outreach enrollments. So, really looking at our programs and the level of capacity of programs able to reach people equitably and able to maybe touch and engage harder to engage populations who might have concerns about engaging with street outreach workers and really taking the time to build that trust. And that would not include only people who identify as Black African American, but this was a case of a fairly stark equity issue. Just pausing if there's anyone who wants to share a comment or has any feedback.
I'll just make note the number of like engagements that the street outreach team is doing is not necessarily reflected by enrollments in client track. And so I'm very curious to kind of dig into this more and really try to understand that how this is playing out in the data, because we do kind of vary street outreach enrollments based on what level of services and engagement people are looking for. For example, if I need to book someone an Uber ride to an appointment, that I might enroll them in street outreach to be then eligible to pull from that grant to book them an Uber to street outreach. So I guess I'm curious to dig into this more.
Thank you. That's also important context to know.
For them to be in HMI, for them to be entered in client track, there has to be an actual service provided.
I would say Not necessarily. We provide services that make, for there to be a literal cost expense, right? So like. if
Related
I-
to the service.
So if I buy, and like even supplies, like I can buy 50 tents and I'm not necessarily tying each of those tents to a specific client track number. Because for me to buy a $40 tent and enroll someone in client track, then discharge them, then do a 90-day follow-up for just a supply like a tent.
It's not reflective at all.
It's not reflective at all is what I'm trying to say.
Gotcha.
I think that street outreach is having north of 400 to 500 engagements on a monthly basis with people, an engagement being defined as engaging with someone outside of our property. And we probably have 4 or 5 enrollments in client track each month. So we're talking about vastly different, kind of levels of engagement, I think. So I wouldn't say client track has ever been fully reflective of the quantity and diversity of who we're working with and engaging with.
John, would it be okay if we follow up with you to get those exact numbers or more exact?
Yeah, I'd be happy to meet after or another time.
Awesome. Thank you.
Thank you. Okay. And so in terms of what we have heard, when talking with clients regarding themes around just unsheltered homelessness, we heard pretty few people who had encounters with outreach workers. And we also heard that the resources, very broadly defined, were not enough to meet the demand. So resources in terms of shelter space, resources in terms of, ability to get people who could, help you with phones and electricity and stuff like that. Resources in terms of food programs and people who are able to pass out supplies, that people needed more than what service providers were able to provide, though people generally spoke very well of service providers and were happy with case managers and really knew people were trying their best. We also heard that the weather response for people living unsheltered, that there could have been room for more advanced notice and more coordinated activities there in terms of warming centers and emergency places for people to stay. What we heard from providers is, yes.
All right, what was the breakdown of the clients that you guys interviewed? Because those, I would be surprised if those were those were issues identified by families experiencing homelessness, for example.
It's unsheltered, I think, specifically.
Oh, so okay.
Yeah.
I'm sorry. Thank you.
That's okay. Yeah, so I can get you the breakdown. I do not have it in the slides. I can look it up.
I think it says it. It's these were all interviews with people who are unsheltered.
Yes.
So there's
From
another one
slide.
from people who are sheltered.
Correct. Yes.
Okay, great. Thank you. Thank you.
No problem. And so what we heard from providers is that people who are living unsheltered, again, there's a lot of fear about engaging. People are, reticent to give up their location for fear of having their encampment cleared or something punitive like arrest to be able to happen to them. We also heard that services for people who are unsheltered, such as meal programs or outreach services where outreach workers can cover, is a fairly limited geographic area in the county. And so with the While Athens has fare-free transit, which we heard great things about, that it is limited, so it can be very difficult for people to get around to all of the different places you may need to get around to really put together a service regime for yourself. We also heard that providers are struggling with really acute mental and behavioral health issues that right now the resources do not exist to really be able to fully meet that need. And resources in terms of both staffing and funding levels and facilities and just about everything else. And so yes.
Sorry, I would be interested in if those were all individuals or there were any people with children who were interviewed for that. I'd love to know if you guys could locate and were able to interview some unsheltered families with children.
Yeah, so some of the people we interviewed who were unsheltered did have children, but I'm thinking of one couple definitely, but their family was not currently intact because they were unsheltered. So the children were not living unsheltered with the parents.
Okay, so there weren't any families with children with them.
There were no.
My understanding correctly?
Correct. The
Okay.
client interview poll did not include any intact families.
Thank you.
Great. So with that, I will pass it to Heather.
Hello. So as Scott said, where we are is we have been collecting a lot of information and data between the quantitative data, qualitative data, all of that. And as we move towards making recommendations of strategies, we need to pull in people who know more about the local context than we do to understand what some strategies that work in other communities, is that something that makes sense for Athens-Clarke County, right? And you all know that better than we do. And so I'm going to throw out some things that have worked in other communities and would love to hear your feedback. And so first talking a little bit about coordinated outreach. And just as a reminder, we're primarily focused on this slide at this moment on unsheltered homelessness. So thinking about how can we bring together 211 data, different funding streams, different partners to have a really cohesive coverage and roles in terms of being able to respond to people who are living unsheltered wherever they are and however they appear.
But this is unsheltered individuals. This is not encompassing
this is unsheltered
people
humans
with children, but they haven't helped inform it. I'm just making sure I understand.
Yes.
Because we're talking about two totally different approaches and situations.
Yeah, and I think no, I hear you. Sorry, there's like a tiniest bit of a lag, so I don't mean to interrupt anybody. So I think where we are, so there's a limitation in who we were able to interview. Yes. And I think there is a genuine desire for the strategies to address all people who are living unsheltered, unless this advisory committee disagrees with that idea.
I think we're all on the same page that we want it to encompass all, but the data, I just don't see how it's informed by the entire population experiencing homelessness. And obviously we can't address every single little niche within it, but people with children is a significant one.
Well, my understanding, I think, with the people with children, they haven't gotten there yet because the majority of the families that maybe they interviewed were sheltered. They did not find any sheltered or unsheltered homeless families, which might be a point to consider in regards to the process here, that they were unable to find and or interview unsheltered families. And that's something that we need to take into consideration when we're looking at prioritization, that maybe this is something that was missed in the consultation, that because they weren't able to talk, I'm assuming maybe, did they talk to providers to discuss the extent of unsheltered family homelessness here, or was that part of the
We
discussion?
were certainly engaged in that, and we could have helped. We could have helped lead to some families that, I mean,
Well, we're certainly not done collecting all the data, to Evan's point, so we can follow up and maybe you can help us identify some families who are unsheltered with their kids who would be willing to talk to us. I know it's a challenge in general because of all the whole defects
Yeah.
potential, right? I also do want to point out that when we did, again, we're bringing in a lot of the data that we did for Home ARP into this larger plan. And remember, we did that community survey that went out to, I don't even remember how many hundreds of people we got, but I know there were some individuals there, some families with children, and there's probably some unsheltered ones in there, but I'll look more carefully through that data, Shay. And in my meeting notes, I'll include it, what that number.
it is an
Unfollowable.
entirely different ballgame and it's a significant, and the numbers are larger. of
Yeah.
Families experiencing homelessness, than individuals, so.
Yeah, and I think, I don't remember if it was Scott or Heather, but we all know that the numbers are always going to be under representative, right? Just by nature of the communities that we're working with. So, but yeah, definitely, we're going to make sure to follow up with you. So you and Madison and everyone else who works with families, maybe help us identify at least a few.
Thank
that we
you.
can follow up with.
Would there be an opportunity to reassess the providers and just have it from the provider's standpoint on their assessment? If you don't identify the families, at least the providers can be more robust and
Well, I think-
give your voice.
I think that was-
specifically about that group.
Well, I mean, that was my question. We do see and we do deal with families. That's not necessarily our priority, but they come to us. However, we did not have a large discussion on family unsheltered homelessness within our interviews with them. I'm wondering, among the family providers, was that discussed, unsheltered familial?
Shelter was really what was discussed, and the need for more of it because there's so many unsheltered, but we didn't talk about approaches or ways to consider unsheltered people with children in terms of an overall strategy. Thank you.
And I'm wondering, to what extent that can be discussed among the providers. And John, you feel free to weigh in, but I'm thinking because of the stigma and because of the defect situation. And, there might be a situation where parents of children are unsheltered, but the children are staying with aunts, uncles, parents, grandmas,
Frequently.
whatnot. And that might not necessarily fall, but that's still a need. And that's still an issue to be considered when we're looking at this one.
Yeah, no, thank you for identifying that gap, and we'll follow up with y'all providers, to help us identify families, and then also get your perspective on that unsheltered family thing. Does that sound good, Cloudburst?
Yes.
Yeah, okay. Thank you.
Yeah. Any other thoughts about the need, the desire, or ability to better coordinate outreach across Athens for unsheltered humans in general?
I think from a police standpoint, I think that we already do work pretty closely and collaboratively with PD, and that has improved greatly in the past couple of years. We were able to, work with the county on establishing the county to no longer show up and run people out of wherever they're living unnoticed. They go through the street outreach team to at least give people a heads up if they're camping on a space that it is criminalized to camp on, which is a lot of spaces. That being said, that's the law and they enforce the law and there's liability if they don't. So I can understand that. But I would say we do work. Even PD will have private landowners call them to have people removed from their land, and PD will advocate to at least give them 72 hours or 5 days and notify the street outreach team as well. And we have a recurring meeting twice monthly with PD leadership, street outreach, and any service providers or property owners it's kind of like a drop-in hours to talk about encampments that are essentially at risk or about to face kind of a sweep or closure. And how do we compassionately respond to that? with referrals to resources. I'd also on the previous slide question the point of outreach workers are not reaching folks enough. I would wonder if that's coming from a specific demographic within the unsheltered community. Our team has a goal and is fairly successful at reaching every camp that we know of once a week. That's what we try to hold ourselves to. So I'd be curious if there were a certain demographic of people that said that, so we can try to address and collaborate. I know like at First Step, for example, we're there for 2 hours every week, just holding open hours. And we tend to get anywhere between 1 and 4 people per week that meet with us. So I'd be curious if those people said that and also are the ones that are tending not to meet with us.
I would like to add, in this particular context, when we're talking about unsheltered individuals, I am encouraged by these recommendations, given the fact that in each bullet point, from my perspective, I think we are doing some. What we're missing is the capacity to expand in each of these categories. But you look at coordinated outreach, it's there. Within our own street outreach, we've got 2 individuals that, do it for the entire county. Engaging police, we've got the co-responders, we've got the alternative response team, we've got the beginnings. So with Housing First, we've got expanded emergency shelters with Bigger Vision and Salvation Army. We've got the First Step encampment, activities going. We've got the beginnings of the supporting survivors. We've got, a really strong domestic violence programs, and even within our family programs with Almost Home, Home Shelter and Family Promise, there is an element there that we are addressing some of that. So this piece, as far as these strategies, these aren't like new concepts to us. I think we've got the existing infrastructure within the community to expand on existing efforts, within that, kind of like what, we were talking about with with Piedmont Hospital. Coordinated services, emergency room access, and things like that. I think there's a lot of possibilities there. So this seems like a relatively simple hurdle to overcome when we're talking about unsheltered individuals.
I actually think we're doing much of this. I think we can be doing it better.
Yeah.
I would love to incorporate 211 more cohesively into it so that their information is always up to date. I mean, there are things we can improve on in all of it, but
I'd also
we
like
do
to,
these things.
I'd also be curious to if street outreach had a more easier way of enrolling people into a database, because we're heavily disincentivized to, or not incentivized to enroll people into Client Track, because with that comes, okay, hey, nice to meet you. I know I'm engaging with you at your camp in the woods. What's your social security number? What's your birthday? What's your everything? So many questions. And then whenever we do discharge them later, we have to do all those questions again. Again, people come and go, people disappear. We'll see them. We won't see them for 6 months. It can be hard to get quality data. We get nicked by, the HUD will get mad at us when we do anything wrong. And then HUD they also want us to do a 90-day follow-up with all these people, which is very difficult. And so the way that our kind of database through, DCA and all that is set up makes me really not want to get in trouble for either making up data or putting missing data. I don't want to do that. So we don't do that many enrollments.
Yeah.
If coordinated entry was a much simpler workflow, or there was a simpler version of a coordinated entry workflow to get people into the system, I think people would be really open to working with us. But our coordinated entry workflow in Athens, I believe, is longer than than just a street outreach inflow. And so that creates, problems for us too, because it's not, hey, what's up? Good to see you again. What's your social? That's harder to do. Do you drink? Do you have mental health diagnoses? All of those questions are personal and can be hard to do outside of an office setting.
And if we try to capture a client in Client Track without having all of that information, we get dinged for incomplete record keeping, and we don't get reimbursed. And that money is already spent and it doesn't come back, and none of us are going to be operating if we don't get reimbursed. So it's really, really geared towards keeping people out rather than putting as many people in as we work with.
It sounds like, and I really appreciate this conversation. I also like, I'm generally not the best at time management, so I'm trying to also move us forward because I know Scott has more to share with us and we have more that we want to hear from you. But it's really helpful to us to hear that there is an appetite in your community to engage in these sorts of models, and it's more of a infrastructure and funding sort of situation. It's kind of what I'm taking from that. I'm going to let Scott move forward so that we can talk a little bit more about emergency and transitional housing trends as well.
Thanks, Heather. Okay. So this slide, I think getting at conversation earlier about housing inventory and shelter resources has, this is from your housing inventory count. So these are the numbers that you reported to HUD. Resources have increased, but again, so have the number of people who are experiencing homelessness. So while there has been a substantial increase, especially in transitional housing, that is needing to serve an ever increasing number of people.
Point of clarification that from 2020 to 2022, we included a number of transitional housing programs that already existed that were not previously included in PIC counts.
Great, thank you. We were able to look at the project geocodes and geocode some data about the counties that are neighboring you and the emergency and transitional housing projects that were reported by the Georgia Balance Estate. And according to that analysis, there are few to no resources in the counties neighboring Clarke County. This aligns with what we heard. A lot of people were not from Clarke County. They were from a neighboring county and had essentially no choice but to come to Clarke County for shelter. But what we also heard was that to obtain housing, these households were often pushed back out of Clarke County. And so that included households who maybe were not from Clarke County to begin with, needing to leave Clarke County to obtain housing, but that also included Athens natives who, in order to obtain housing, were needing to leave Athens to be able to do so. And so when we look, this is from HMIS data, which I know we're hearing, which is important to hear about the limitations of that data set. But this is looking at enrollments from 2022. So who is enrolled in shelter, and then where did they go? So about, in both cases, about a quarter of people who are enrolled exit out into permanent housing. And so when there's this kind of bottleneck in the system, it further strains resources, because you see, like we saw on the first slide, where even though there's more and more shelter and transitional housing being created or being accounted for, if no one is able to exit those programs into permanent housing, or a few people are exiting into permanent housing, that people are staying with those resources, and it's not freeing up that space for the next person to be able to come in. And so it seems possible that there is some of that happening in Athens-Clarke. Again, and this is just following trends that are observable nationally, with tremendous increases in rental prices, sharply decreasing rental vacancy rates, and then more qualitatively, but people, landlords and property management companies being less willing to accept vouchers and stuff, contributing to that bottleneck.
I was just gonna ask, so our Advantage has 2 projects that would be defined as transitional housing by HUD. Neither of those are funded through HUD, so neither of them are on client track or report on client track. So, and a number of those people exit with the Georgia Housing Voucher Program. So those numbers are likely not reflected here.
This is just client track, right?
This is just, that's part of my question. Is this just client track, I guess?
I believe so.
Okay.
Is exiting to rapid rehousing included an exit to permanent housing?
If they were housed, not just enrolled in that rapid rehousing program, but if that led to.
Number feels really low to me. I mean, I feel like, I'd like to understand where that number comes from better.
I know you said that this data came mostly from client track, and I know you said that y'all are still collecting data. Where else were y'all attempting or are planning to collect the data from?
General, so we've pulled from HMIS, the hit count. We're also, and I don't know if we've gotten to this point yet of reaching out to the different agencies to try to get some data from y'all.
And I remember about
Maybe
2
we
minutes
haven't.
ago that I said we wanted to make sure that we provided some data, but I hadn't been asked for any.
We haven't gotten to that point yet. That sounds like.
Is y'all's data, I know it's separate, it's Alice, but is it?
Caseworthy.
There's no way that those figures are recorded in client track at all?
The only ones from client track would be the people who are enrolled in our rapid rehousing. But nobody else, so.
Let's see.
It really does feel low. Yeah.
But that includes all the individual ones.
Right, but Bigger Vision wasn't on client track until
Head of
this year,
household
right?
too.
Yeah,
Talking
So
head of
this
household is 125.
Because bigger,
But that could be larger if it's just the head of household who's included.
and I'd also like to, like Bigger Vision, when did y'all start on client track? Like
January 2023, so we won't.
So they're not skewing at all. It would, I could see Salvation Army potentially skewing on the individual side since they're not, running a robust housing. They have some level of housing supports, but they do more now.
They're supposed to.
Yes.
This is not broken out by household type. So this is just every single person who was enrolled. Some of those people would be part of the same household. Some of them would not be. They would be, single people. So it is by the individual level, but it's not just people who are presenting as individuals.
So if it was a family of 5 that exited and housed in rapid rehousing, 5 would be reflected there, not 1 for the head of household. Is that accurate?
That should be accurate. It would depend on making sure that every single one of those 5 people was exited properly in client track. But yes, what you described is how it should be reflected in the data.
And is there any level of deduplication in this sense too? Because I know sometimes someone will have housing at the, 95-day mark, but have to leave their family shelter at the 90-day mark and might come to our shelter program for 5 days before they move in. That
Happens a lot.
happens, from time to time.
Yeah. No, so this is really looking at that enrollment. So we could go further down and clean the data. We don't know how things like that happen, but if someone, was engaged in services and then was exited from those services, not just like a night by night shelter situation, but there was a break in their service record within HMIS that was not to permanent housing. And then they came back in another program that would show up twice in that enrollment tab. So this is not just, it's not saying 25% of all individuals, it's saying when you enroll someone and take them through services, 25% of the time that for shelter programs that is leading to permanent housing.
So that population of people that go from one shelter to another shelter to housing would skew the data down or skew that percentage number down,
Yes.
no matter the length.
So basically, we just all know that the data is seriously flawed. Yeah, and I mean starting with the point in time counts.
Yeah, and that's why we include all this, like, all these different data sets, right? And the qualitative interviews, et cetera, because we can't just rely on any one data set. And it's
And I
true
would
for every single population, especially these months.
I was going to say, and Athens-Clarke County is not that unique in having data limitations. You know, as someone who has been a service provider, your focus is not always on putting data into HMIS, but on serving humans, right? So I don't want you to feel too called in about your data.
Yeah. Thanks. I'm going to move us along. So again, what we heard from clients is that it was difficult to navigate the system and often entailed making a tremendous number of different phone calls. There wasn't any kind of like coordinated process or place that you could call and get information that was accurate about shelter availability broadly. You kind of had to call each place. And that said, people, especially people who either came in from a neighboring county or people who this was their first time experiencing homelessness, that they had a lot of difficulty understanding what was available and how to get what was available. We also heard that the shelter environments shelters that were not specifically for survivors or families were really challenging for survivors of violence and families. Often cases, the survivors of violence are families, right? So that it was not that some of the general shelters were just not appropriate places. While we did not speak to anyone, again, who directly had children with them, who was living unsheltered, we did actually hear about that from victim service providers who have been helping prepare people to live in their vehicles with children as survivors of violence instead of going into shelters, even if space is available. We also heard that people were really not able to navigate housing well, that there was challenges with that as well. So a lot of times people were, for example, issued a voucher and then the voucher was in their hand and it was really up to them to go out and call apartments and fill out applications and figure out how to use that. There wasn't a lot of assistance available navigating with landlords or navigating places that might be amenable to taking that. Again, we heard from providers just about the strain of resources, particularly with bed and unit availability in response to demand, and just fielding a large number of requests, both for a place to stay and for other things like help with case management and housing navigation that simply could not be fulfilled with current staff and funding levels.
I noticed when you say voucher on little housing navigation, are you referring to rapid rehousing primarily?
So this is in reference to just anyone who was trying to look for housing. So yes, some people got rapid rehousing, some people got emergency housing vouchers, some people had found places. Yes.
The only two voucher programs that I'm aware of are the Housing Choice Voucher and the Georgia Housing Voucher Program. No homeless service, that's the Housing Choice Voucher is operated by the state. And then the Georgia Housing Voucher Program Advantage does operate, and clients have a housing support specialist who do assist with a housing search in that process. Rapid Rehousing is the program specifically that, at least internally for us, that we do not have capacity to provide housing search assistance for. So I'd imagine that all of those people are probably talking about rapid rehousing.
No, not all of them, because we asked about what kind of housing resource they had. So it was actually quite a variety, and some people didn't have any subsidy at all and had found a job and could afford rent on their own at an affordable level. And, we're again, just, even though you might not think about, that population as part of like a housing navigation group, definitely, I think we're expressing the desire to have that kind of assistance, even though they did not have a subsidy.
Well, certainly, and I think, something like a flexible housing fund or something that can open up doors to get people through the startup costs who don't have an ongoing housing subsidy would be incredible and remarkable, and is a gap in our community. As I get constant referrals from people that may not meet qualifications for rapid rehousing explicitly, have a chance, who are working, who don't have an ongoing housing subsidy, but have a chance to get sustainably housed because they're working and doing those things, but may not have the funds to fund the startup cost up front. And so those, I think that there are examples of people like that would be great for something like that. And I'd also just note that a number of people, no matter how many times we tell them rapid rehousing is not a voucher, continually refer to rapid rehousing as a voucher. So that's part of where my frustration comes from, is I think every single day people are coming up saying, I have the voucher. And I say, no, we've talked about this 20 times. You have rapid rehousing, which is not a voucher. A voucher is an ongoing subsidy. Rapid rehousing is a short to medium term rental assistance program.
I'd like to mention also, I think on this point of housing navigation assistance, like it totally makes sense that folks are saying that no matter what situation they might be in, rapid rehousing or no rapid rehousing, and just looking in general, because what is a case manager supposed to do if there's no housing available, right? So
Right.
I can pretend to try to navigate you in the direction of all these landlords that either aren't willing to work with you or you don't meet the requirements or whatever. So I think that's probably a true statement that families or individuals feel that way, but how do you navigate something?
And at the same time, we hired somebody to do nothing but that, and it didn't make a significant difference at all. It really didn't. So we gave it a try. The problem is the lack of affordable units. That is the problem. And the willingness of landlords, to be honest, as well. But really, it's the lack of units.
And I can tell you, I have a number of people that I've dealt with in our emergency shelter program who actually do have, a Georgia housing voucher, and I use the V word carefully there, that have, with the support of a housing support specialist, and then both actively looking from Macon to Augusta, not able to find units for them because we operate the entire DBHD Region 2 for that program. So I certainly agree that it is hard to navigate the housing assistance. I think that clients, with their best effort of them and their caseworker, are doing that. Now, if we have a landlord that calls us and says, hey, I have a unit, I'm willing to work with rapid rehousing, great. How many people do I have on my caseload that are approved for rapid rehousing, that I'm trying to think through who is most fit to be successful in this opportunity to maintain this landlord relationship, not get evicted right after. So, I don't have a lot of units to connect clients to. So I'm not actively, telling people, hey, this is the one person who accepts rapid rehousing. All 40 of you call them by tomorrow and we'll see who wins. I'm going to help kind of guide that process so it's hopefully successful.
Mm-hmm. Mm-hmm. Thank you. I'm gonna turn it back over to Heather. Hopefully we can get some of your feedback for a few minutes.
Yes. So yeah, some strategies that have been implemented in other communities. I'm just gonna throw them all out there and let you all respond. So thinking about doing regional models from what we've heard about people moving into and out of Athens-Clarke County. looking at how resources can be shared across county lines. So doing a lot of work with coordinated entry to better incorporate shelter into that process to ease any navigation challenges. Looking at really bolstering case management in shelter and transitional housing to better support quick exits to permanent housing. And then also having really robust diversion and rapid exit programs. So how can we get people from even having to go into shelter or being able to get out of shelter, move on from shelter really quickly, right? So yeah, so just wanting to hear your initial feedback on those sorts of strategies.
I mean, as we talk about quick exits, again, I think I'm going to point to the supply of housing as the issue with that. I can get someone in shelter. I can get them in front of a psychiatrist with a prescription of mental health meds if they need it. I can have them an ID and a social security card in most cases, a birth certificate if it's in state, within, I would say, 5 to 8 business days. And then with that, if they're chronically homeless, I can get them a Georgia housing voucher. If they're, able to work, I can get them with a supportive employment professional who can get them a job, usually within, 24 hours of meeting with that person. So I think from a case management standpoint, I'm able to get the supportive services in line. I'm able to get the approval for rapid rehousing or Georgia housing voucher or whatever the program is, but I don't have the place to send them to. Because I have a lot of clients who all have the same, 1, 2, 3 person households, good income, good job. Some of them make over the income threshold and don't qualify for it, but I can't find them housing, whether they're making $60,000 a year as a household or making, $950 on a disability check and get on a Georgia housing voucher subsidized program.
Is this the appropriate time to be giving feedback on, for example, I've got feedback on shelter being incorporated into coordinated entry. Is there a later time where we give that formally, or is this plan being adapted based on feedback today?
Please, yes, we would like your feedback today, as much as possible.
I think we would all agree that informally doing coordinated entry for shelter and the idea of handing it to somebody else to try and regulate or dictate feels like it's going to throw a wrench in the whole works that we have figured out how to do on our own. And to establish a coordinated entry that handles all rapid rehousing and shelter needs seems like such an incredible shift from where we are that I'm almost not sure of how we get there. I mean, it would have to be a separate entity managing all of it, basically.
And from a coordinated entry standpoint, I don't know that I would say coordinated entry is very functional at all in Advantage's experience, because our coordinated entry, we already have to do a full intake workflow once we do an intake with somebody, and then we also do the VASPID with them. And then we also have to go through a whole bunch of paperwork with them about our policies and procedures and all that, which is all fine. But the coordinated entry workflow is the longest of all of them. And so frequently when we have, 20 people at our door to do an intake that day, and we only have the capacity to see about 5 or 6 of them, we're not, it becomes a time of, do we really want to ask them the same questions over and over again for coordinated entry, when we usually do coordinated entry for families, but when it's a single individual and we're the only person that coordinated entry workflow is going to get referred to, we don't always do that, because, it's just going to get referred back to us.
So it sounds like there's some challenges with your coordinated entry system, that more work could go into it to make it more effective.
Well, and I guess I would just wonder who those coordinated entry workflow is going to go to for single, adults, because it almost always just goes back to us. I don't think any of the other single adult, housing assistance programs are on Client Track. Correct me if I'm wrong. I know, like
Salvation Army's supposed to be.
Salvation Army could be.
on rapid rehousing, and
No, their rapid rehousing is not really.
it's not right.
considered rapid.
It's just like startup costs is my understanding of it. And so it's like, if we're doing a coordinated entry workflow on a single individual, okay, it goes back to the county, whoop-de-doo, it got referred back to us. And like, what's the point of, we already enrolled them in Client Track. We already tied them to Advantage because we did their VASPADAT.
We're
You know.
doing this. I mean,
Right, and like, so like when we have a
We're not
family, we put
having
them in coordinated entry, so if they happen to land on a family provider's planning list, great, awesome. But if they're, if not, like, we're just referring them to ourselves, basically.
And we also, providers meet on a weekly basis and
Right.
discuss this. I mean, it's happening. It's just not happening the way it looks everywhere else, but it's happening.
And that's okay, because I think every community is different, right? And what works here can be very different from everywhere else in the state, et cetera.
I just can't envision who would manage that in a way that will be effective for all of us.
What would be some ways that it could be more effective? Forget about who would handle it, right? Because that could be part of like the larger strategy later. But what would be some ways that we could improve on what y'all are also doing to make it more efficient and more effective, not to create more work?
I'm thinking about this number 2 coordinated entry based off of probably what folks were saying about having to call shelters and figure out, navigate it that way. And from the client's perspective, which I get that they have to call each one, and that is probably an area that could be fixed. But at the end of the day, like, we have anywhere between 50 to 100 families that call us and are seeking shelter for our 3 units. So it's going to be difficult on their side because there's no way to, equitably try to figure out who.
Right, and it's not first come, first serve either. It's really based on, I hate to use this word, but kind of desperation, like who is the most in need, who's the most in danger, what family is the least safe and needs shelter right now. That's really how it's filtered.
And family size, family type,
Yeah.
individual as well, like all of that goes into it. So it's not a science.
I don't know who would have the knowledge to be able to take that on. I think that we have compensated as a community and communicate well to.
The only thing I can see, and coming from more of like working with individuals living in the woods perspective, I think that it would be, there's a number of people who probably are not and will never be in Client Track until they decide that they want to show up and do an intake at Advantage. Because I would love to have an easier way to get someone enrolled or at least existing in Client Track without DCA breathing down my neck about having all of their data exactly perfect and neat and doing a 90-day follow-up with them after some vague street outreach enrollment period.
I think the data we have is like in Client Track is probably all really good, but it's not all captured there.
It's not, right, because someone on your wait list may not be captured in Client Track, just like someone I meet in the woods may not be captured in Client Track.
I like number 4. I think that there should be more flexible resources
Yes.
to be leveraged. As John was talking about, we've heard of other, places doing things to add to nonprofits' budgets that is more flexible than rapid rehousing. For Family Promise, we have a small-ish amount of flexible funds that we use for things like security deposits, or housing application fees, or all of the small things that add up for families. So it's really helpful to not have to be stuck to those guidelines when most of the time families, individuals, whoever can't find anything that meets the guidelines. So I'm interested in that as well.
Right. And there's certain things that I feel like with the strings attached of some federal fundings that you can and can't pay for.
Right.
Like I have a client right now with a housing choice voucher that I'm trying to work to move into housing, but I can't pay for that person's utilities because none of my funding streams will allow me to double dip and have someone with a housing choice voucher and a HUD, some other HUD funding stream. We have another grant that they're figuring out how to use for this, but it's kind of a stretch at that point. It's like, it'd be nice if I had some flexible funds to get this person from homelessness into sustainable permanent housing.
Thank you all so much. We do have a couple more slides that I want to make sure we can make it through. So I am going to move us along for now, but you all do have Alejandra's email, and I believe you should have at least one person on this team has reached out to you. So please do get in contact if there's other feedback that you wish to provide. Oh, okay, found my mouse. So we want to close by talking about permanent housing. And so again, looking at your housing inventory count, you have added rapid rehousing capacity, but permanent supportive housing capacity has actually been decreasing. I'm going to go through these and then we can talk about it all, I think, with the strategies given the time constraint. So we also looked at client track data deduplicated for what is the potential need for supportive housing, given, you know, people who did not exit to permanent housing, who have a disabling condition or are chronically homeless. And again, the potential need there, not every one of these individuals may want or actually need supportive housing, but it's substantial, especially compared to the amount of supportive housing resource that you have. So what did we hear from clients? We heard that vouchers and other subsidies like rapid rehousing are sometimes going unused, or people are having returning vouchers because they cannot find a place to use it with. And so they are remaining without housing. We also, again, heard the need for more navigation support than what is available. We also heard from a few people who had either recently been housed or gone through a prevention program. And I just want to emphasize this was a small number of people, but that there was not a lot of post-housing support available when it was desired. We also heard from providers that the private housing market, again, is increasingly strained, very difficult to navigate. And we also heard that there is no permanent supportive housing available for families, which again, kind of locks out a population from the housing and services that they need to be stable.
There's seven units.
Well, there's also, there's also permanent supportive housing through the Georgia Housing Voucher Program that is relatively new, but that is technically a PSH project that's not captured in client track. So there is a whole nother kind of permanent supportive housing project that is probably missed. Now, I know these are coming from client interviews though, so I don't know if any client interviews came from people from GHVP, maybe one. I'm not sure.
Good point.
But yeah, I know I've had a handful of households housed on Georgia Housing Voucher come through our emergency shelter at the hotel and then get housed with kids on Georgia Housing Voucher, and that's permanent supportive.
Thank you. I will turn it to Heather to think through some of these strategies, if they're feasible, what your feedback is in the last couple minutes.
Yeah. So Scott shared data around rapid rehousing possibilities as well as PSH. So questions about can RRH capacity be expanded, and what kinds of services will be needed to serve higher acuity populations in rapid rehousing? So rather than just, so we're making sure that we're supporting all of those folks experiencing chronic homelessness or having one or more disabling conditions. In terms of developing PSH, thinking about what do we need for developers to create new supportive housing units that are more site-based there? What is the feasibility of scattered site PSH given the rental market? So just wanting to hear a little bit of your thoughts on that.
Can you go to the next slide so that we can see?
The next one or the previous?
Well, oh, there it is. Okay.
So you want to go back to this slide? Sorry.
Okay, I think that I might have missed that slide. Never mind. Thank you.
Go ahead, Julie.
Yeah, go ahead.
Oh, thanks. So as far as rapid rehousing capacity being expanded, I don't understand how that could take place, given that the people that we currently accept into rapid rehousing have a hard time finding units. So simply taking on more or saying we have a bunch more money to serve more people doesn't translate to getting those people housed, unfortunately.
We had to return money from our rapid rehousing grant last year because we just could not put people in units. We could make them eligible, they were eligible, but there were not units for them.
And also from Advantage's perspective, we're at the point now where we've been able to use and spend down a lot of these, rapid rehousing funds, but we're on complete pause right now on rapid rehousing move-ins because we're not able to, we have lots of people who are approved for rapid rehousing and they're not necessarily returning it. They just can't find units.
Sorry.
And if they all were to find a unit today, we certainly would not have enough money to do it, but we can approve that many people because we know there's no way they're finding units right now.
Also, even if we could somehow change the limits or surrounding fair market rent and such, and when we paid what market value is for units, our population isn't going to be able to sustain that as soon as it's over. So rapid rehousing really doesn't seem like an answer in this community, at least not with the way we're required to operate them in the current, status quo.
That's helpful feedback. Thank you.
So it's not necessarily lack of funding to do it, it's just literally lack of units.
Yeah, if we had the units, we'd be filling them all up and asking for more money from the state, but the units aren't here.
Good thing we're doing an affordable housing strategic plan too, huh?
Yes, I hope it comes with lots and lots of affordable apartment units, rental units.
Any other comments on these?
I can't think of services that would help with rapid rehousing, really. Like I said, we've tried dedicating a staff person to landlord development, basically.
I think AVHS provides a lot of outpatient, community-based mental health supports for higher acuity populations some of which do end up being successful. But at the end of the day, someone's bound to their autonomy. And if, the only available units is in a place where they're going to live next to the person they buy their dope with or drink with, right? Like there's only so much outpatient supports we can do. That person's not really set up for success. So how do we really expect, the single individual who went from, living in the woods for a couple years to go into rapid rehousing and then live next to the person they do the dope with? How do we expect that person to legitimately be successful? Throw all the supports we want at them, but that person's probably not going to be successful in that environment. Because that's not going to be a conducive environment to them having any success, to them sustaining, going to their appointments, and maintaining employment, things like that.
And is this definition, the definition we're using of permanent supportive housing, meaning ongoing case management, not just subsidized housing?
Yes.
Okay.
Georgia Housing Voucher would.
Really, you guys are the only ones in town who are doing that, right?
With shelter,
Permanent supportive housing,
that-
shelter plus care.
And Georgia Housing Voucher has ongoing case management as well. It's not as intensive as shelter plus care. I think it's monthly, 1 to 2 times a month, or kind of as needed, but I think it does meet somewhere in the PSH category because it is a permanent voucher.
Barring raising minimum wage, we need more permanent supportive housing.
Okay.
And disability checks.
Yes.
Right. And part of that, some of this feeds into the affordable housing plan that is not within our sphere of influence right here. But wanting to hear some, is it feasible to do more scattered site PSH? Or is there really a need, and it could be or, really a need for site-based PSH where there is a need to support developers to create that housing?
I feel like that's not a developer's issue. I feel like that's a funding issue. Permanent supportive housing. I mean, all of the family permanent supportive housing units, except for the new voucher program, which I am not informed enough about, but they're all located in one place with plenty of supportive staff around, whether it's directly with that program or other programs. And that seems very, very important to overall success of it, in our experience.
I would say, as far as scattered site goes, again, we're looking at fair market rents. And so are we able to talk landlords into working with a permanent supportive housing program of either people with a SPMI or disabling condition of some sort and or chronically homeless into leasing their units at the fair market rent? And who are those landlords that are willing to do that? My guess is, are there places where they're not going to be set up for success because of who their neighbors are inevitably going to end up being?
And yeah, so sorry, were you done?
Yeah, no, I mean, that's what I'm saying is when we talk about that, you know, I got to think through who's willing to work with us, and it's going to be people where it's probably not going to be the best neighborhood for somebody trying to do things differently in their life than they had when they were living on shelter or in shelter.
Can developers, this is my lack of education on this, but I feel like if you offer a developer the type of tax incentive or credit that's needed to convince them to develop low-income affordable units, I'm not sure a permanent supportive housing program would be able to utilize it, because I think that would be considered double dipping. I think. I know rapid rehousing wouldn't be able to utilize them because it's considered double dipping. So I'm not sure that looking at it from the point of view of trying to entice developers for this specific permanent supportive housing is, I don't think that works.
Isn't that like a disability?
It's not double dipping. It's not double dipping. And I mean, a lot of it varies from state to state.
You cannot
And
do it with rapid rehousing in Georgia. You cannot. It doesn't work.
COC either.
Right.
So
I think part of
You're
this
sure you're confident it works in Georgia? Because if so, I would like to take that to the Affordable Housing Committee as well and talk about that there. But I'm not sure that it's possible.
Well, I think part of this too is hearing from you, what are the paths that we should be exploring? You know, so I think what we're hearing is that there are lots of barriers with the private market with convincing landlords. So if it was possible to create more site-based permanent supportive housing, is that a solution that you all want to explore? And we can look at issues of feasibility, or what are the barriers, what are the challenges to actually achieving that?
I think we all agree we need a lot more of it.
Absolutely.
And we need a lot more of it for families specifically. Or we need to increase minimum wage tomorrow.
And I think on a transitional level for single adults, individuals to go through that, you know, that initial phase of I'm going from living in the woods in a chaotic lifestyle to I'm living in a structured kind of transitional environment. I'm learning to go to my appointments, learning then of those ADLs that they may be lacking from living in the woods, addressing the underlying trauma, things like that. You probably can go eventually be successful living alone, but need a time of transition. And I think that, you know, that's been very successful with our hotel program and very successful with our semi-independent mental health residential program and our crisis respite program. The issue we face is they're in the bad neighborhood. That's the hardest part.
Thank you all. We are over time, and I just want to be respectful of everyone's time and commitment. So I'm going to forward us to the next steps. So again, we will continue provider interviews. We have things scheduled out until about next Tuesday right now, but there is still time to respond. If you have not, please do so. We would really appreciate this kind of context and your suggestions that we have been able to dive into one-on-one. We have developed in Athens-Clarke County staff are currently fielding a survey geared toward businesses based on their request. and a survey for students, and that would include both high school students who are over or 18 or over, as well as college students who are experiencing homelessness. We are going to continue reviewing your current funding flow and be working with ACC Gov to identify those best practice models for strategy implementation. We are meeting again in about a month, and we will present to you for, again, additional feedback and refinement, the strategies that we develop in partnership with ACC Gov. And then in July, the final draft plan will be due. And at that point, I know ACC Gov will have additional engagement opportunities.
I had a couple people contact me about the business survey, and there was a couple suggestion questions that only allowed 255 characters. Both people said it was a little challenging to.
So increase the field.
Please.
Yeah, we can increase it to 1,000.
That's an easy fix.
Thank you.
Yeah.
Thanks for putting that out.
Did I see another hand?
Yeah. I just want to confirm that this 5 million we're talking about, and I understand that this plan is going to address a broader funding spectrum, but this 5 million, it has to be spent by the end of 2026, correct? Allocated or spent?
We need to allocate it by the end of 2024 and spend every cent by 2026, the end of 26.
I'm really concerned about this timeline.
We're not gonna wait
don't get it.
until, yeah. So again, the plan is to have Mayor and Commission vote on the plan in fall. It's probably gonna be September, October. I can't remember exactly where we landed. And by the end of the year, we're hoping to have an RFP out.
So
we'll have.
realistically, we would look at
26.
executed contracts sometime in the summer of 24.
Hopefully spring. Yeah, but we'll
So
still
maybe we'll
have
get 2
2.5
years.
years, 3, maybe, more like 2.5 years to spend the money. Yeah.
And the 2.5 million is by 2030, right?
Yes, the 2.5 million from home ARP is by 2030. And that's something that Cloudburst is gonna help us figure out, like, how do we spend ARPA first, right?
Yeah, and if it goes into services, for 2 years, we'll have more robust services and then we won't. And that doesn't do us any good.
Right, and the
So-
idea with the plan too, though, is because the 5 million, ARPA is always gonna be temporary, it's gonna go away. And for housing, for all the different categories, but it buys us a little bit of time to get this flexible housing fund, for example, kind of set up. If that's something we decide as a community, if that's something we all think is gonna be helpful, it buys us a little bit of time to figure out how to do it in a way that makes sense, it's gonna be sustainable. That's how I'm looking at it, at least, because it's just a Band-Aid for a couple years, unfortunately.
Or it could go into capital projects, which would expand capacity and guarantee spending. And then maybe the funding spectrum we hope to incorporate can then support increasing services.
Right. Yeah, we can use it more for like in an infrastructure kind of way.
It
Like
just
I
seems
feel
like
like
we have to be intelligent about how we approach getting this money actually spent. Because the crunched timelines to spend money in the past several years have been really challenging to work with. And I think I hope we've learned from it so that we can approach this differently.
Yeah, and that was the idea of holding back on the 5 million until we had a little bit more clarity of how we can use it strategically. And I know it puts pressure on y'all as agencies to have to spend it quickly. But we're gonna help you do it in a way that's gonna help us, like, set us up for success, I guess, in the longer term. But yeah, either way, it's really hard and challenging. So
Yeah, I'm not gonna wanna use that money to hire staff, for example, because I'm not gonna hire staff unless I can offer a job I'm confident we can sustain.
Right. Yeah, there might be other ways.
Go that way.
We can help y'all also, I think, we have ACD, but also help y'all figure out how to be strategic with, like, how do we pair CDBG with ARPA, et cetera, so that it all kind of works together. And you're not put in a position where you have to fire staff members in 2 years. But we'll cross that bridge. I think right now we want to figure out what's the strategic buckets and what's kind of longer term, short term, midterm goals that we can agree on and build kind of consensus on. Yeah.
I have an observation. I'll try to be quick. On today's presentation and the strategic plan. First, just that we have a lot of faith in this plan to be an important tool to kind of transform this community. And I want to commend Heather because on your strategies, I think those are progressive, evidence-based strategies. So I definitely want to say that, but with the caveat that I think we all agree in those strategies, and some of them are already being implemented. And I know that there were some kind of comments, impromptu comments that, oh yeah, we're already doing that. We already engage police. That's not the problem with our rapid rehousing programs and so on. But I just want to ask or to request that a more methodical kind of conversation about which are being employed, because those strategies, which are all well and good, if that's what informs the strategic plan, and a lot of them are things we're already putting into practice or have already tested in various ways, that's not going to be the most useful tool for us. So I just wanted to make that observation.
I didn't appreciate it.
Excuse me.
Okay.
I want to say, what are y'all gonna do about housing?
We have a whole nother plan that we can discuss. Let me just wrap up this meeting officially. Are there any other comments on this plan? Again, you're gonna have a bunch of other opportunities to provide feedback. I'll send you this deck so you can look at it more carefully. I know it's hard to see on the big screen. Call me, send me emails with your feedback.
That meeting on May 3rd?
Yes, so May 3rd, I'll send out the invite. May 3rd, so almost a month from now here, 3 o'clock is what we're thinking. But I'll send out the official invite.
Is that for the same group?
Okay, yes, for the same group. All right. I will adjourn the meeting unless there's any other.
Thank you.
Yeah, all right. Thank you all, and I can stop the live stream.
Only.
Okay, thanks, Cloudburst.
She don't want
Yes.
to. But I mean, I wanted to say something because I am.